the peripheral lymph nodes as they relate to our practice. So the lymphatic system is a massive topic to talk about, and we're only going to just touch the surface. So later on in the program with, I believe it's normally with Jocelyn and Med, you'll talk about acquired immunity and immunity in general, especially as it relates to vaccinations. And then later in fourth semester, you'll talk about the cytology of lymph nodes and changes to the lymph nodes, including things like cancer, reactivity, etc. So this is just a basic overview of the lymphatic system. So the lymphatic system is similar to that of the circulatory system in that there are large lymphatic vessels or ducts that connect to smaller lymphatic vessels and ducts all throughout the body. And while they're connecting with each other, they're also passing through these small little bean-shaped structures called lymph nodes. So what they do, the series of vessels and ducts, they carry excess interstitial tissue fluid to blood vessels near the heart where the fluid is put back into the bloodstream. So this is fluid that's come out of the tissues and is just sitting within the body. It's not necessarily in circulation yet, and the body wants to get it back into circulation to maintain homeostasis and ensure that the fluids are being utilized throughout the body. So it picks up all that extra fluid that's just hanging around and brings it back up to the blood vessels near the heart, and then it's dumped back into the bloodstream. This also includes lymph tissue scattered throughout the body. So lymph nodes, we've got the spleen that we'll talk about, the thymus, the tonsils, and the gut-associated lymph tissue. For us, the most important will be the actual peripheral lymph nodes, which I'll talk about more toward the end, because we palpate these on a daily basis in our jobs, and they tell us a lot about the health of the animal. So lymphatic circulation, the lymph capillaries join together to form larger and larger lymph vessels, very similar to the circulatory system. Many contain one-way valves that prevent the lymph fluid from flowing backwards. And the body movements help propel the lymph fluid toward the heart. So again, this sounds very similar to that circulation of veins, okay? We use valves and we use body movements, i.e. the skeletal muscle pump, to help pump that lymph or that lymphatic fluid back toward the heart. The lymph vessels eventually join to form the thoracic duct, and that's the duct that empties specifically the lymph into the vena cava just before it enters the heart. Okay, so the lymph, when I say lymph, the other term is lymphatic fluid. So when the lymph reaches its way, makes its way all the way up through into the thoracic duct, that then empties it into the vena cava, and then it gets emptied into the right side of the heart for circulation. So this is a quick little picture about just looking at the lymphatic system and how it's all connected, very similar to the circulatory system. So you have a series of lymphatic capillaries, lymphatic vessels, large lymphatic vessels. They're all connected together. They end up at the heart, well, toward the lungs and then the heart, and then they reach their way back around through circulation. And all these bean-like structures are called lymph nodes. Okay, and that's a little cross-section of a lymph node. Now, some of these lymph nodes we can easily feel on an animal because they're superficial, so those are called peripheral lymph nodes. And we'll talk about those, but some examples are the popliteal, inguinal, axillary, and submandibular. Prescapular is another word as well for cervical. And again, we feel them to make sure that they're normal feeling, they're not enlarged, and we're not seeing any disease processes. Lymph vessels pass through at least one lymph node and pick up little lymphocytes, so those are the little white blood cells. Any microorganisms in the lymph are removed by macrophages found within the lymph nodes. Macrophages you'll learn a heck of a lot about in fourth semester. Macrophages are phagocytizing white blood cells. So they're large, essentially inflammatory white blood cells that will eat debris, eat organisms, and eat other cells. So they're really important, and they remove any microorganisms that are found in the lymph. Lymphatic system functions. So the purpose of it is, one, to remove excess tissue fluid and bring it back into circulation. Waste material transport, so the interstitial fluid contains some of the waste materials from the tissue cells. filtration of lymph, removal of microorganisms, cellular debris, and other foreign material, and protein transport. So I talked a little bit about the lymphatic vessels and a little bit about the peripheral lymph nodes and the lymph nodes in general. So there are other lymph type structures that are involved in the whole lymphatic system, one of which is the spleen. So we talked about the spleen a little bit in class, especially that it looks like a nice hard taco shell quite often on x-rays. So it's a tongue-shaped organ located on the left side of the abdomen, and it tends to be central or slightly cranial. Near the stomach in simple stomached animals, and it's near the rumen in ruminants. It's the largest lymphoid organ in the body. The functions of the spleen are to store red blood cells in the red pulp area, removal of foreign material from circulation by the tissue macrophages in the red pulp, removal of dead, dying, and abnormal red blood cells by the tissue macrophages in the red pulp, and it clones lymphocytes in the white pulp during an immune response. So it has a huge function or a huge role with red blood cells, in particular in the storage of red blood cells and in the destruction of dead and dying red blood cells. That being said, well, that's fine. I'll leave that. I'm just going to carry on. So a spleen is often an area too that you might come across in regard to vet medicine as you're practicing, because in large dogs, quite often, it's not uncommon to have splenic tumors. So normal spleen really does look like a tongue. It's about the same, well, a little bit, it's about the same size as a human tongue in about a medium to large sized dog. So what this surgery is, it's showing a massive splenic tumor. Okay, and it's either a hemangioma or hemangiosarcoma. Quite often, one's cancerous, one's benign. But massive tumors can grow in the spleen, and they tend to be fairly quick growing. And clinical signs include a dog. Most often it's a dog. It could be a cat as well. But most often it's a large, medium to large, little bit older dog who comes in and they have pale mucous membranes. Okay, they might be a little bit lethargic or quite lethargic, depending on if the spleen has ruptured, but they tend to have very pale mucous membranes. They're lethargic, they're not eating, and quite often they're vomiting as well. So the reason for those clinical signs, if they have a splenic tumor, if we go back to the spleen functions, blood storage. So the spleen, the purpose of the spleen, one purpose of the spleen is to store red blood cells. So if they have a massive tumor on their spleen, and especially if that tumor ruptures, all those red blood cells are now being released into the abdomen. So again, they're not circulating the red blood cells the way they need to be, so they get very lethargic. Their red blood cells are not reaching their peripheral capillaries, so they don't have nice, happy pink mucous membranes. So very pale, very lethargic. And then, of course, the doctor would diagnose with ultrasound or other means, but quite often with ultrasound to start with. So splenic tumors, not uncommon. They can get quite big, and they most often happen on dogs that are medium to large and middle-aged to older. Tonsils are another organ involved within the lymphatic process. So they are nodules of peripheral lymphoid tissue, not covered with a capsule, and I say that because the lymph nodes are covered within a little capsule. So they're just soft tissue. They're found close to the mucosal surfaces all over the body: pharynx, larynx, intestine, prepuce, and vagina. And it just depends, species specific. Dogs have two tonsils altogether. And then tonsils in the pharyngeal region prevent spread of infection into the respiratory or digestive systems. And they're located at the beginning of the lymph drainage system, not along the lymph vessels like the lymph nodes. So the tonsils are essentially the oral tonsils, the tonsils located in the pharyngeal region. They are responsible. The key thing to know here is that they're responsible to prevent the spread of infection into the respiratory or digestive systems. So if we think about this with us, we often get a sore throat and swollen tonsils if we have our tonsils when we're fighting off a respiratory infection. So a respiratory flu, a chest cold, that kind of thing. So tonsils are the first things to get swollen if it's a respiratory or digestive virus that's coming into the body. The thymus is another lymphoid organ. and it's located in the caudal neck and craniothoracic region on either side of the trachea. So this is the thymus, and again, it's not encapsulated, similar to the tonsils. It's simply soft tissue. Most prominent in young animals, and it processes thymocytes and T cells. And T cells are a type of lymphocyte involved in the immune system that I won't go into detail about, but you'll definitely learn much more about those as you carry on in the program. And then we have gut-associated lymph tissue, also known as GALT. And this is lymphoid tissue found in the interstitial mucosa and submucosa. It's the largest lymphoid organ in the body. Now, I think I also said that for the spleen. Yes, I lied. So the gut-associated lymph tissue is the largest lymphoid tissue in the body. The spleen is not. Because this is spread all throughout the small intestines. It's super important. So in the small intestines, it was always a surprise to me, but they have a huge role in lymphatic processes and a huge role in the immune system. And the small intestines are actually responsible for releasing a lot of those lymphocytes to assist in the development of antibodies and to fight off foreign invaders. So GALT is classified as both central and peripheral lymphoid tissue. But just to note that it's most common in the small intestine, and it releases lymphocytes, specific little charged lymphocytes, to assist in antibody development to ward off foreign invaders. I'll talk about this with you heaps in fourth semester. All right, and then most important to us as registered vet techs are the peripheral lymph nodes, and that's because these are palpable, superficial little encapsulated lymph nodes that give us a good idea of what's going on with the animal. So peripheral lymph nodes, you may have felt them on yourself if you've ever been fighting a cold or a flu. Quite often we call them our glands, and they get swollen under our mandible or at the back of our neck. Very common. You can also get swollen lymph nodes in your armpits and your groin, and it's the same with a dog and a cat and a horse and a cow. And there are various reasons why they might be swelling. Quite often it's contact with a virus, so the body's actively fighting off a viral foreign invader. And as that virus makes its way through the lymphatic system, it works its way through these lymph nodes and they start to become a little bit swollen, a little bit reactive. It could also be worst case scenario, or one of the worst case scenarios is that it could also be cancer. So again, it's really important during physical exam to palpate the peripheral lymph nodes. And quite often we palpate the mandibular, prescapular, and popliteal. Those are the ones that are palpable in normal cats and dogs. And then if we've got generalized swelling, or swelling in general, of some of the lymph nodes, so not all of them, then you'll be able to feel the axillary and inguinal. So axillary is under the armpits and inguinal is in the groin of these animals. So sometimes they get swollen because of viruses passing through. There could be a bacterial infection within the lymph node. There could be all sorts of reasons for them: reactivity, hyperplasia. And then, like I said too, unfortunately, they also swell up if the animal has lymphoma. And I'll show you a picture of a dog who has some swollen lymph nodes. Dogs who have lymphoma are more likely to have swollen peripheral lymph nodes. So these are the dogs that come in and they have generalized swelling of their peripheral lymph nodes. So that means all over the body, the lymph nodes, we can feel them. We can feel their axillary, inguinal, popliteal, prescapular, mandibular, and they can be the size of a golf ball sometimes. Now, it might not be all of the lymph nodes that are swollen, it depends when the lymphoma was caught, but it could in fact be all of them. Cats who have lymphoma, they tend not to display lymphoma in a way that has enlarged peripheral lymph nodes. So cats are always different than dogs, and cats tend to get enlargement of the lymph nodes in the gut. So mesenteric lymph nodes, rather than coming in with big swollen peripheral lymph nodes. So we always palpate with a cat as well. It's often if a cat has generalized swelling of lymph nodes, it's less common for it to be lymphoma than it would be for a dog, because they display it in a different way. And cats too, unfortunately, when they get lymphoma, if we think about the clinical signs that would be associated with having swollen lymph nodes in the gut, disturbances to the gut, we think diarrhea, we think vomiting, pain, Diarrhea, vomiting, and pain in cats. There are so many different things that can cause, especially vomiting and diarrhea in cats. I mean, you look at a cat the wrong way and it starts to vomit. So cats we often miss the lymphoma in cats, I find from my personal experience. It's often missed until it's quite substantially developed. Whereas dogs, if they start to show these enlarged peripheral lymph nodes, we can physically feel them, we can physically see them. So the lymphoma tends to be caught a little bit earlier and treatment started earlier. Cats, I find, because they're so good at hiding and everything makes them vomit, it takes a while to catch things like lymphoma. Okay, so these are the general locations. So we've got submandibular is our most common, probably the most easily felt lymph node on a dog and cat. And it's right at the corner of the mandible, right where the mandible connects down to the throat or the neck of the animal. And you reach your hands back on either side, simultaneously feeling both lymph nodes on the left and right side for comparison. We want them to be the same size. In a cat, they're about the size of a green pea. And in a dog, it just depends on the size of the dog. But if it is a Chihuahua, they're probably about the size of, not a grape, maybe like a large blueberry. And then working our way up in, say, a Great Pyrenees, so like a 130-pound dog, they can become quite large, about 3 centimeters round or so. And then we can work our way down their shoulders, feel for prescapular, feel for axillary under their armpits. I always feel for popliteals, and a really good time for you guys to get to know where these are is during TPRs with your second years, and also during surgery class next semester. So once an animal is out under anesthetic, their muscles are very flaccid, they're not trying to get away. I say that sounds weird, but it's a very good opportunity when they are under anesthetic just to do a quick palpation and make sure that you know where your popliteals are, where your prescapulars are, etc. So the popliteal lymph nodes are just proximal to the hock. So here's our hock right there, calcaneus, and just right in there, right at the start of the hamstrings, is where you'll find the popliteal lymph node. Dogs and cats typically don't mind lymph node palpation either. It's enjoyable. If you make it enjoyable, it'll be enjoyable for them. Just pet them as you go along. Cats think that you're petting them the whole time. It's pretty good. It's just something to definitely get acquainted with early in your practice. So like I said earlier, you palpate them simultaneously with your index finger and your thumb. And it's important to note which peripheral lymph nodes are enlarged. Is it just the mandibular? Is it across the body? Cats are the size of a pea. Dogs dependent on the size of the animal. So here's a dog with visibly enlarged lymph nodes, and that's the submandibular lymph node there. Now again, if your dog has an enlarged lymph node, it doesn't mean that it's lymphoma, especially if it's one lymph node. If it's all over the body, I think your red flag should go up a little bit more and definitely be a little bit quicker to go see the vet. But there's lots of different things that can cause lymph node inflammation. Just like with us, if we're fighting off a cold, a lot of times our mandibular lymph nodes will get inflamed. So don't freak out, is what I'm trying to say. But you can see here, there's my mouse. Right there is a peripheral lymph node enlargement. Excellent. Okay, right there. And then these, they're really hard to see. I'll circle them. So we've got these tiny little lymph nodes, and these are called mesenteric lymph nodes. This is, I'm not sure which animal this was. This could have actually been a pig. But mesenteric lymph nodes are often the location of lymphoma in cats. Okay, so this is the mesentery, that beautiful tissue with vessels, with fat, connective tissue that holds all the gastrointestinal organs in place. And within that mesentery, we have little lymph nodes throughout. So those are mesenteric lymph nodes. And sometimes they're visible on ultrasound if they're enlarged, but sometimes it's an exploratory surgery in order to find them. I can't get rid of my little circles. Okay, and then these guys, this is a horse with swollen lymph nodes. And not only are they swollen, but they've actually ruptured. So this horse has something called equine strangles. And equine strangles is a bacteria strain that's highly, highly, highly contagious. It's one that we definitely alert the government to if a horse is found to have equine strangles. And what often happens, so they get this streptococcus bacteria, Streptococcus equi bacteria. It enters their blood system and it accumulates, it goes through the lymphatic system and it accumulates in their lymph nodes. And it often starts out with pyrexia, so increased body temperature, and then they start to get a nasal discharge that's purulent, so it's yellow and thick. And then they start to get swollen lymph nodes, and most often the swollen lymph nodes are the mandibular lymph nodes and the parotid lymph nodes that get swollen in the horse. So what happens is they get extremely swollen and they can actually start to choke the horse, hence it's called strangles. And then over time they start to rupture, and when they rupture they leak out really thick purulent pus. And that pus is extremely, extremely contagious to other horses. So it absolutely has to be well regulated. The horse has to be confined and treated ASAP. Puppies also get strangles. There's one called puppy strangles. And again, the animal is what I've found and what I've seen is that the dogs come in, they're quite young, and they have a really sore neck area, so really sore cervical area. And again, it's because of swollen lymph nodes. And then they have swollen mandibular lymph nodes, and they have pyrexia, and they're often not eating, lethargic, etc. So they've got a bad fever, swollen lymph nodes, and a sore cervical area. We had a case not too long ago at work. So puppy strangles. So again, treatment is key, ASAP. And that's about it. So the other thing I was just going to show you, this is just a quick Google of palpating lymph nodes in the cat, but I thought it was really helpful and beneficial. So looking at your cat and your dog too, you can do it exactly the same way. In order to palpate the submandibular lymph nodes, you start with the base of the mandible and just work your fingers simultaneously back toward the base of the mandible where it connects to the throat, and you're using your index finger and your thumb just to gently pinch. And you're not pinching causing pain, you're just gently pinching until you reach in and you feel a pea-sized, a little encapsulated pea, essentially. And it should be slightly mobile. And then once you have it in your hand, you want to be able to find the left and the right side and compare the two together. This is a good one showing the popliteal. So that's the location of the popliteal. So we've got our hamstring group, and at the distal aspect of the hamstring group, just proximal to the hock, is where you'll find your popliteal. And they're a little bit harder on fat animals, so fat or obese animals, because of course they get that chubby chub fat back there. But on most cats, especially, and most dogs, they're quite easily palpable. Also, highly muscled dogs, it can be a little bit tricky to find the popliteal as well. And then here he or she's feeling for the axillary. So not auxiliary, just be aware that it's my pet peeve. An auxiliary is a person, it's a helper. Axillary is the armpit, okay? Just to be aware of that. Okay, so we've got the axillary feeling within there for the axillary lymph nodes. And then the other one I was just going to show you is I'm just going to mute it, a doctor who's showing clients how to palpate lymph nodes on their own animals. So she's starting with the mandibular lymph nodes, and that's exactly how we palpate them on a dog, and they don't mind it at all. So you're reaching toward the base of the mandible where it connects to the neck, and you're putting your hands in toward that crevice of the mandible in the neck, and then you're pinching as you come away from their body. And then she's going down the dog, feeling for prescapular lymph nodes, showing you the general location where they'd be found. And the dog doesn't mind. He thinks he's getting a massage. So that's typical to find the prescapular lymph nodes if they're palpable. And anytime you do palpate them, you want to make sure that you are comparing the two sides. And then she's working her way into the axillary region. Again, the dog thinks it's just getting a really great massage. There we go. And then lastly, our popliteal lymph nodes. So you can see the location now. It depends, just depends on how long their legs are. Essentially, they are proximal to the hock and quite often just on the caudal aspect of the stifle, slightly distal, but approximately caudal aspect of the stifle and a little bit lower. So these are things that you should really start trying right away in order to make it so that by the time you reach second year and you are responsible for performing the TPRs on the animals, that you're able to palpate with comfort the lymph nodes and know what normal and abnormal lymph nodes feel like.